Vitamin A, 285 page number. So there are two types of vitamins. One are fat soluble and another is water soluble. Fat soluble ones are vitamin A, D, E, and K. Water soluble ones are all vitamin B complexes and vitamin C. Okay, these are water soluble. Water soluble vitamins on a daily basis, the intake has to be maintained. Fat soluble vitamins can be stored within your body, specifically in your liver, and some of them are even stored in your muscles, okay, and other soft tissues. Majority of the fat soluble vitamins are stored in the liver, okay. Is my voice clear to all? Am I audible to all? So there are different forms of vitamin A. Okay. Vitamin A comes in different forms. The vitamin A which is found in plant-based diet, plant sources are different as compared to the vitamin A you get from animal-based diet. Okay, animal sources. So preformed vitamin A, that is retinol, it is only found in animal sources like fatty fish liver oils, meat, lambs, okay, organ meat, whatever we have now, like specifically liver of any animal, okay. So that also has retinol, vitamin A, okay. All the dairy produces breast milk while feeding infant, okay. Through that also vitamin A can be passed on, and it is stored in liver, okay. Retinol form of vitamin A is stored in liver. Then we have provitamin A in the form of beta carotene. Beta carotene is only found in plant-based sources. All the red, orange, as well as yellow, okay, red, orange, yellow fruits and vegetables like mango, papaya, carrots, red palm oil, capsicum, the bell peppers, capsicum, the red and yellow ones, they are also good sources of vitamin A. Okay, so any fruits and vegetable you take which are red, orange, or yellow in color, it is a great source of provitamin A, that is beta carotene. Okay, dark green leafy vegetables, example spinach, is also a good source of beta carotene. So provitamin A has to be converted into retinol, and this conversion has to take place in your intestine. Only then, after it has been converted into retinol, that's an active form of vitamin A, and then it can be transferred into the bloodstream, and from the bloodstream it will get deposited wherever it is, for example in the liver, or wherever it has to be get used into, like retina and all, okay. So this is how vitamin A, the different forms of vitamin A you get from two major sources. Animal sources, it is retinol, and in plant-based sources, it is beta carotene, okay. Retinol will also undergo a lot of changes within the human body to get other forms of vitamin A. So you can see the conversion here, okay. Conversion factors you can see here. Beta carotene, this is plant based, okay. So the plant based beta carotene is slightly larger in structure. If you see, it has to get hydrolyzed, it has to get broken down, okay. Am I audible now? Is my screen visible? Am I audible now? Is the screen visible to all, or is the screen still loading? As soon as it is visible and it is completely loaded, please mention in the chat box. Okay. So this is the conversion of beta carotene. This is the conversion of beta carotene into retinol. This conversion has to take place in your intestine. Okay, beta carotene has to be converted inside your intestine. This is a plant-based source, and when it is converted into retinol you will get it from animal-based source as it is. From animal-based source, this one step has to be excluded. Okay, directly retinol, the active form of vitamin A, is absorbed. Okay, and this retinol will undergo oxidation and it becomes an aldehyde. Now, this is in an alcoholic form. Retinol is an alcoholic form. It has to undergo oxidation. It becomes retinol, aldehyde. And then it am I audible? Is the screen visible to all? Am I audible? Is the screen visible to all? Is the screen visible now? Am I audible? Is the screen visible? Is the screen visible? Am I audible? And in human beings, beta carotene is based plant-based food is better absorbed than all the other carotenes. Okay, beta carotene is best absorbed from as compared to all the other carotenes like alpha, lycopene, lutein, zeaxanthin. Okay, beta carotene is best absorbed. Your body responds well to this beta carotene, and also the variety of food that you find beta carotene in. Okay, the way how beta carotene present in papaya is absorbed, and the way how beta carotene present in carrot is absorbed is completely different. Okay, bioavailability of beta carotene is completely different. Okay, for example, beta carotene in papaya is better absorbed than the beta carotene that is found in carrots. Okay, both are beta carotene. The beta carotene that you see in carrot is also the same structure. The one you find in papaya is also the same structure, but the beta carotene present in papaya will be absorbed better as compared to the one you find in carrots. Okay. So the absorption range of beta carotene is given in a small table, table 15.1 on page number 292. Okay, you can check that how well the beta carotene is absorbed in percentage wise. Okay, crystalline beta carotene is the synthetic form which you find in supplements. Okay, crystalline beta carotene, it is found in supplements, and also red palm oil. Coming to the health benefits of beta carotene, cancer, it has an anti-carcinogenic effects, as I have mentioned earlier. Specifically, cancers, it reduces the risk of cancers in female reproductive system, gastrointestinal system, mouth, gums, trachea. Okay, because all these cancers are epithelial cell cancers. Okay, if your epithelial cells are undergoing problematic cell differentiation, okay, it will lead to cancer. Okay, so all these cancers are specifically epithelial cell cancer. Okay, so beta carotene can reduce the risk. It will not prevent, it will not cure, but it can reduce the risk of cancer, specifically the cancer which I have mentioned here. Next is cardiovascular disease. Okay, to fight against cardiovascular diseases, it has shown, beta carotene has shown positive effect. Okay, specifically people who suffer from angina. Angina is chest pain. Okay, so supplementation of beta carotene has shown to reduce chest pain in in certain men who had an history of heart attack. Okay, who had a previous history of heart attack, and after heart attack, when they were put on carotene supplements, chest pain, the frequency of chest pain reduced. Okay, then cataract. So cataract means what? It's the clouding of your eye lens. Okay, clouding of the eye lens. So there has been a link of free radicals damaging your eye lens over a period of time, and that leads to cataract. Okay, so people who had low serum carotenoid level, they had the highest risk of developing cataract, 5.5 times more risk of developing cataract. So there is a link of cataracts and beta carotene. So having beta carotene rich food, it can reduce your risk of getting cataract. Specifically, if cataract is something that runs in your family, if you remember your grandparents, if grandparents from both the sides had suffered from cataract, it's better. You should never fall in the deficiency of serum carotenoid levels. Okay. Then gastric inflammation, it can inhibit presence of carotenoids. It can reduce your gastric inflammation, and it can also reduce the effect of Helicobacter pylori, which causes peptic ulcer. Okay. So these are the health benefits of beta carotene. Coming to the RDA required for vitamin A, you require at least 1000 microgram of retinol for an adult man. And if a person is having a plant-based diet, vegetarian or vegan diet, they will require 6000 microgram of beta carotene. Is the screen visible? Am I audible? So you can refer table 15.3 on page number 295 to get the RDA for different age groups. Specifically in children, it's important. Children also usually get immunization of vitamin A. Vitamin A is a part of your immunization schedule as well to prevent blindness in children. For adults, if you have a non-vegetarian diet, 1000 microgram of retinol should be maintained on a daily basis. If you are a vegetarian or a vegan, 6000 microgram of beta carotene on a daily basis has to be maintained. For other age groups, they have mentioned it in the table 15.3. Okay, you can refer that. Sources of vitamin A. Best sources are your dairy products and eggs, dark green leafy vegetables, all the yellow, orange, red fruits and vegetables, cauliflowers. Okay, even blue green algae, spirulina, that is also a rich source of beta carotene. Sheep liver, liver organ meats, specifically liver or organ meat, is a good source of vitamin A. Yellow pulses may not contain beta carotene. Only fruits and vegetables. So how much vitamin A is present in these foods? Just a comparison between a vegetarian diet and a non-vegetarian diet. If you have 50 gram of raw spinach, around 42% of vitamin A you will get. If you have sweet potatoes, okay, absorption rate around 153% of your daily recommended value you will get. Liver pate, that is a non-vegetarian dish, okay, around 157 daily record. DRV means it's a RDA, daily recommended value or recommended daily intake. DRV stands for that. In India, we call it as RTA. Some other nationalities, they call it as DRV, etc. Okay. Sources. Primary natural sources of vitamin A is animal products, liver, eggs, milk products. Okay, plant-based plant sources, red, orange, yellow fruits and vegetables, green leafy vegetables. Okay. Yeah, absorption rate is different. That's the reason why we have mentioned the percentage also. What is the bioavailability percentage was mentioned in the previous slide. You can check that later. This is leaf curd. Leaf curd can be used by vegans. Okay. Leaf curd is used by vegans. So it's a leaf concentrate, green leafy concentrate. It is extracted from plant proteins or from any edible plant. So for vegans can use this as a curd. You can check online regarding the leaf curd or leaf concentrate. If you require the link for that, you just WhatsApp me. I'll forward you the link of this um, uh, link regarding leaf curd. Okay. So vegetarians will not require it because you can get your vitamin A from eggs or milk products, dairy products. But vegans has to be like, you have to be careful about this. Oxalates present in the leaf curd may affect the absorption of calcium. It will affect the absorption of minerals, but it should not affect the absorption of vitamins. Vitamins are organic compound, minerals are inorganic compound. That's the main difference between vitamins and minerals. Okay, both are micronutrients, but vitamins have a carbon structure. Vitamins have a carbon structure. Minerals do not have a carbon structure. They are inorganic nature. Okay. Vitamin A toxicity, or it is also called as hypervitaminosis A. So these are the signs and symptoms find which you can find in vitamin A toxicity. Increased cerebral spinal pressure, generalized weakness, fatigue, headaches, dermatological issues like too much of drying, peeling, itchy skin. Even those who are on topical applications of retinoic acid, tretinoin, etc., or those who are taking oral medication of Accutane, that is isotretinoin. Okay, the most potent form of vitamin A. Even they suffer from the same dermatological issues: dry skin, peeling skin, itchy skin. Okay, and it also affects your mental health also. Accutane depression, risk for suicide, it's usually connected. Upset stomach, nausea, vomiting, hair loss, nail infection, bone pain, joint pain, liver and spleen enlargement. Okay, because too much of vitamin A could lead to inflammation of liver, hepatomegaly, splenomegaly. Okay, this can it will take years and decades to manifest. Okay, you do not get vitamin A toxicity within a day or two. Okay, or over a period of time, you had large quantities of vitamin A rich food, or your RDA was much more than what was recommended for vitamin A. It will take years to show these symptoms. Okay, except for if you are on a specific medication of vitamin A. Apart from that, just through diet, if you are getting hypervitaminosis A, it will take lots of time to manifest the signs and symptoms. It can happen through food as well as supplements. If you are taking unregulated supplements without a guidance from a dietitian or a physician, okay, self-medication, toxicity can happen. So that's about vitamin A part 1. Vitamin A deficiencies. Is my screen visible to all? So preschool children are the age group which have the highest risk of developing vitamin A deficiency. Less than 50% of their recommended RDA is what they consume, preschoolers. Okay, and these are the states which has reported the highest rates of vitamin A deficiency. Okay, Tripura, Mizoram, Jharkhand have the highest rates. States like Karnataka, Goa, Maharashtra, Rajasthan, Jammu Kashmir, Himachal Pradesh, West Bengal, Sikkim, Meghalaya, they have the lower rates of vitamin A deficiency. So epidemiology, which means what are the social factors that leads to or puts a risk on vitamin A deficiency? Age. Usually you will see this deficiency in children. Okay, in infancy it is rare because you have a good maternal nutrition and your liver is born, infant's liver is born with enough amount of vitamin A, and breast milk is also giving them vitamin A. During infancy they will usually not suffer from deficiency. Preschool children are at higher risk. Okay, so in age preschool children you have to watch for specific you have to check their eyes frequently, because eyes will start showing symptoms of vitamin A deficiency. I'll show you, it's bite or spot, I'll show you later in the slide. Socioeconomic factors, specifically children who are from rural tribal families and also kids who are from low income families are the most vulnerable groups. Okay, because they are also at high risk of developing malnutrition. Okay, protein energy malnutrition or uh, severe acute malnutrition. So that's how epidemiological factors will affect your risk of getting vitamin A deficiencies. What is the etiology? Etiology means what causes vitamin A deficiency. First and the foremost causes you're not taking enough vitamin A. Inadequate dietary intake. Your diet lacks vitamin A. So that is the main cause of your deficiency. Second is inadequate intestinal absorption. It happens in infection. When you undergo a series of infection over and over again, your risk of developing vitamin A deficiency is higher. Not just vitamin A, any vitamin A any deficiency is higher, because when you are sick, when you undergo infection, when you are undergoing some health issues, naturally intestinal absorption slows down. Increased excretion. Okay, if you're using a lot of laxatives, okay, you are under laxatives or diuretics, that could lead to excretion. Then ignorance, not having enough knowledge about vitamin A rich food, importance of vitamin A, female illiteracy. Okay, so, not having knowledge about supplementation, immunization, these things could lead to vitamin A deficiency. Improper methods of cooking, overcooking, cooking at high temperature, over boiling, this could take away the carotenoids from the food. Then different levels of vitamin A status or deficiency. Preclinical deficiency, if you do your if a biopsy is done, or a specific biopsy is done, in which if the amount of vitamin A is less than 0.07 microgram mole per gram wet weight of vitamin A in liver. So this is a biopsy, this thing you don't have to know this in detail. So this is a preclinical deficiency. In preclinical deficiency, just doing dietary changes, you can treat this deficiency. Just make certain dietary changes, you can treat this deficiency, preclinical deficiency. Okay, and satisfactory level, which means the normal levels of vitamin A. So if it is a 75 kg male, they should have at least 0.18 micromole as a wet weight of vitamin A in the liver. It's a 62 kg female, 0.14 micromole of wet weight of vitamin A in the liver should be present. These are the normal levels. Okay, if it is less than 0.07 for both males and females, it means they are in the deficiency side. Clinical features, effect on eyes. Xerophthalmia. Xerophthalmia is the name of the deficiency given to vitamin A deficiency. It's a public health problem. We have a nutritional program run by our government just to prevent blindness, prevention of blindness because of the deficiency of vitamin A. That's an entire nutritional program. It has been released. It has been carried out by the government of India. Okay. Effect on growth. Just if you remember the functions of vitamin A, you can automatically make up all the clinical features of vitamin A deficiency. Definitely the vision will be affected. Growth retardation may take place. Specific in preschool children, when they are deficient in vitamin A, it will show up in their growth. They will not achieve their average height and weight. Okay, they will not keep up their growth as compared to their peers. Okay. Effect on reproduction: low birth weight, premature babies, spontaneous abortions, miscarriages. Okay, not able to conceive, fertility issues. Okay, these all will take place. Increased susceptibility to infection: your first line of defense will be lost because of vitamin A deficiency, because vitamin A leads to the differentiation of your epithelial cells. Epithelial cells are present to protect you. Okay, specific parts of your body which has epithelial cells, like your trachea, upper respiratory tract, nostrils, your GI tract, your stomach lining, they all have epithelial cells which help secrete mucus, gastric acid, etc., which are the first line of defense. If anything happens to that cell differentiation, you are susceptible to infection. Risk of preterm delivery: pregnancy induced hypertension, that is hypertension, BP, high BP, that happens only during pregnancy. And the woman was not having any BP issue before she got pregnant. As soon as she got pregnant, during that entire 9 months, 10 months period, she was suffering from hypertension. That is pregnancy induced hypertension, PIH. And anemia. Okay, these are the why anemia. Stem cells, as I mentioned, stem cells maturation. For that, vitamin A is required. In the absence or in the deficiency of vitamin A, stem cells will not undergo maturation. If stem cells don't undergo maturation, RBC will not be formed, and lack of RBC or less amount of RBC means anemia. Okay. Is the clinical features clear to all? Because now we will discuss the xerophthalmia in detail. So abbreviations are given for each stages of xerophthalmia. It's not like you suffer from night blindness today and within a month you will get xerophthalmic fundus, or you will completely go blind. It happens in stages. Okay, it happens in stages. So abbreviations, no need to by heart. Just remember the forms of xerophthalmia, the stages of xerophthalmia. No need to by heart the abbreviation. Okay, but what happens after which stage will come after which stage, that you have to understand. Okay, these are the different stages of xerophthalmia. Okay, xerophthalmia xerophthalmia means dryness of the eyes. Okay, xero means xerosis, means dryness. Ophthalmia, this is condition of the eye. Okay, so dryness, your eyes are getting drier and drier and drier. Okay, so it starts with night blindness, and it then conjunctival xerosis, mitoid spots, corneal xerosis, ulceration or keratomalacia, corneal scar, and then xerophthalmic fundus. I'll show you each one of these images. Images are coming up. Certain images you may find it uncomfortable to watch. I'm just giving that disclaimer right now itself. Okay, so those who are not from a medical background, or those who feel uncomfortable to watch these images, these are scarring of the eyes and all. Okay, kids having scarring of the eyes, etc. If you're uncomfortable to watch, it's just a disclaimer. You can put off the screen. Just listen to the audio. Okay. So night blindness versus normal vision. You can see the difference here, how a normal vision, a healthy person's eyesight looks like at night, and how a person who's suffering from night blindness, how their vision is at night. Okay, so this is the effect. Which in short, night blindness means what? The speed at which your eye recovers its full powers after exposure to bright light to a dim light. You come from a bright room into a dark room. Everyone will undergo certain seconds of adjustment. You will require a bit of time to adjust your eyesight to the new darkness or dimness of the new room. Okay, but people who have night blindness, it takes them longer, and sometimes they are not even able to adjust to the new dim light or dark light. Okay, that is night blindness. And if it is not treated, it transforms into conjunctival xerosis. Conjunctival xerosis, do you see the conjunctiva here? How does it appear? Is it a normal conjunctiva? What difference do you see in this conjunctiva as compared to a normal conjunctiva? Conjunctival cirrhosis. Do you see? Am I audible? Is the screen visible? Do you see the conjunctiva has become wrinkly? Usually, when you look at your eyes, when you look at the conjunctiva, it has a glossy surface. It has a very smooth, glossy surface. It should not have a mattified look or a wrinkly look. Okay, here it looks very dry. Cirrhosis means dryness. Okay, so this is conjunctiva which is getting drier and drier. Okay, the next stage after night blindness. Okay, this is conjunctival cirrhosis. Then can you see Bitot spot here? These are two different forms of Bitot spot. This is what you have to look for in preschool children. Okay, teachers, Anganwadi teachers, school teachers, okay, parents of a preschooler, you have to look out for Bitot spots. You can see this chalky kind of mattified spot on the conjunctiva. Sometimes it is brown in color, sometimes it is chalky in color. Okay, it has a chalky appearance, chalk-like appearance. And sometimes it is triangular in shape as well. Okay, so this is the Bitot spot. This is the third stage of xerophthalmia. Okay, then we have corneal cirrhosis, ulceration. Here, not just the conjunctiva, but even the cornea, the black part of the eye, the pigment of the eye. This is also undergoing dryness. Earlier, the dryness was only in the white part, conjunctival part. Now the dryness has spread to the cornea as well. Okay, corneal ulceration. If it is not treated, okay, it can, within hours, it can form into an ulcer, and it will not be reversed back. They will lose their eyesight forever. Within hours, if the dryness of the conjunctiva, still you can treat it back. Okay, medication can be given. Bitot spot, you can still treat it. Corneal cirrhosis, you can treat it, but it is time is of an essence here. Within hours, if it is not treated, corneal cirrhosis, it will lead to ulcer formation, and once the ulcer formation has begun, there is no going back. The person will lose their eyesight forever. Okay, then we have keratomalacia. Again, it is not treated, ulcer has formed, it means melting. You can see here, uh, here if you see, there is a proper demarcation between the cornea and the conjunctiva. Even in the Bitot spot, a proper demarcation is there. Okay, you can completely see white part is different and the black part is different. Demarcation is there. Okay, here also a slight demarcation is there. But in keratomalacia, you are seeing a blur happening. It is your cornea is melting into your conjunctiva. Okay, cornea is melting into the conjunctiva. This is keratomalacia. Okay, it's not reversible. You cannot reverse this back into a normal eyesight. Okay, this is keratomalacia. And then you have fundus formation. In fundus formation also, corneal scar or fundus formation, not reversible. It goes into a further state where the complete eye gets melted into one particular shade. Okay, so all the stages, is it clear to all? All the stages of xerophthalmia, is it clear to all? final, you have the evaluation. How do you check for vitamin A deficiency or vitamin A status? Your liver vitamin A concentration is checked using biopsy methods. That is one way of identifying what is your wet liver weight of vitamin A. Then you can check the serum vitamin A, that is, do the blood work, check your blood work, do the blood test, serum vitamin A. It should not be below 10 microgram per deciliter. Okay. Dose response test is done. Small doses of vitamin A is given, and to check how much retinol binding protein, RBP, for if you remember, is released from the liver into the bloodstream. Okay, so that is a dose response test. And over several hours, this release of RBP P4 into the blood serum is checked. The lab technicians and the doctors will know how to interpret the test. You don't have to learn about that. Then conjunctival impression cytology. A filter paper is taken, and briefly a filter paper is kept on the conjunctiva and the filter paper will get wet because of the tears present in the that surround the conjunctiva, and this filter paper will undergo microscopic evaluation. Okay, and under the microscope, the cells of the conjunctiva which has stuck to the filter paper will be checked to identify drying. Okay, because when you check the cells, you will see keratinized cells. If you find a lot of keratinized means dry cells in this filter paper, it means you are having a vitamin A deficiency. It has reached up to your conjunctiva. Then a dark adaptation test, it is done. The patient will be kept the recovery of the patient's eyesight from bright light to dim light, and how long it takes for the patient to adjust their eyesight from bright light to dim light. Okay, they will be put in a bright room. Immediately they will be taken to a dark room, and time will be evaluated, that how long it takes for them to adjust to the new dark room, and based on the time evaluation, the test results will be declared. Then metabolic indicator, retinol beta glucuronide, that's the after metabolism. Okay, vitamin A after metabolism, retinoic acid after metabolism, it will circulate retinol beta glucuronide in the bloodstream. So that if a very low concentration of retinol beta glucuronide is found, it means you have low vitamin A status in your body. Okay. Functional test. Biochemical test. Okay, biochemistry test. It is done in the biochemistry section of the laboratory. It's based on the ammonia, nitrogen, and erythrocyte oxidative stress, etc. It's the medical part. You don't have to study about that, but just remember these are the different test or evaluation methods we have to identify if a person is vitamin A deficient or not. Okay, usually just go with the serum vitamin A level. That is the easiest way, but you have the option of other tests as well. Am I audible? Is my screen visible? Okay. Then we have the breast milk retinol test. Mother's breast milk will be checked for the presence of retinol to understand if the mother is deficient as well or not. tear fluid retinol test. Even your tears will have retinol. So a person who has night blindness, specifically young children, etc. So they will have a concentration of retinol which is very less as compared to regular individual, healthy individual. So these are the different forms of vitamin A tests available. No need to by heart this, just understand the names of it. You should know the names of these tests, that's it. So these are the indices of vitamin A test. Serum retinol level, if it is less than 0.1 microgram per deciliter, it is deficient. Breast milk, again, less than 0.1, it is deficient. Dose response test, all the tests which we have discussed right now. Isotope dilution is a biochemistry test, functional test. Okay. Liver sample, that is biopsy, which we have done the first test, if you remember. Liver vitamin A concentration, that's the biopsy, liver sample. Breast milk retinol, we have discussed that. So different way of reading the different tests, it comes under different indices. You don't have to remember this at all. Okay, just showing how every test will not give you one single answer. Every test will have their own reference range, with the help of which we can identify if the person is deficient or not deficient. Okay, then treatment. Vitamin deficiency should be treated urgently, otherwise, a person can become blind. Nearly all and early stages of xerothalmia can be reversed. Night blindness, bite or stops, bite or spot, conjunctival xerosis. These are the early stages of xerothalmia. We can completely reverse it back to a normal, healthy vision. Administration of a massive dose of 2 lakh international units of retinol orally for 2 days continuously is given for children who are above 1 year of age. If the child is below 1 year, 1 lakh international unit is given for 2 days. Okay, if the child is above 1 year, 2 lakh international units of vitamin A can be given. 2 lakh international unit of vitamin means it comes in a syrup bottle. Okay, one whole spoon. A spoon will also come along with the syrup bottle. Okay, so one whole spoon, which means 2 lakh international units of vitamin A. If you're giving only half a spoon, it means 1 lakh international units of vitamin A. Okay, so the nurses who are administering the medication, or any healthcare worker who are administering this prophylaxis medication, vitamin A prophylaxis, they know how much medication has to be given based on the age of the child and based on the severity of the deficiency. Okay, but this massive dose has to be given within 2 days as soon as you get any malnourished child. All children with corneal ulcers are given vitamin A. If the child is having vitamin deficiency or not, you will not wait for the laboratory test to arrive. As soon as you see any corneal ulcer, bite or spot, okay, conjunctival xerosis, if you see this in any child, immediately vitamin A prophylaxis has to be given. Do not wait for the laboratory test for any other test. Okay. So this is the timings. If the child is, you can see here, if the child is less than 5 months, immediate diagnosis, 500 international unit of vitamin A is given. 6 to 12 months, that is below 1 year of age, 1 lakh international unit. And if the child is above 12 months, it includes your teenagers as well, school children, teenagers, everyone. 2 lakh international units of vitamin A should be given. Okay, first day, second day. And after 2 weeks later, again the same dose you have to maintain. But the first 2 days, successive days, day 1, day 2, this dose has to be given. This dose has to be maintained. Okay, this is the treatment. It's even in primary healthcare center, community healthcare center, private medical hospitals. Okay, everywhere this medication is available free of cost under the national blindness prevention program and the vitamin A prophylaxis program. Okay, these are nutritional health programs conducted by the government of India. Under them, this medication is given free of cost. So prevention strategies which we can follow: nutritional education has to be done to promote the dietary intake of vitamin A, beta carotene rich food. Give this education to teenagers, mothers, pregnant mothers, mothers who are trying to conceive, preconception. Okay, teenagers through community health awareness programs, training the ASHA workers, training the ICDS workers and staffs. Education has to be given. Child survival, CSSM means Child Survival and Safe Motherhood Plan. These are different programs which we have. ICDS means Integrated Child Development Scheme. Okay, so and CSSM, Child Survival and Safe Motherhood. Okay, supplementation is given free of cost. Supplementations are also free of cost from the primary healthcare center. You can avail the supplementation. Red palm oil, use of red palm oil has to be encouraged. Curriculum, that is school syllabus. In school syllabus, the importance of vitamin A has to be mentioned, because usually what happens, mothers teach their children. Okay, mothers teach their children. It's usually the role of the mothers at home or homemakers at home. Whoever is the homemaker, they teach the children. Okay, if they're literate, they tend to teach the children about vitamin A. Okay, am I audible? Is the screen visible? So in the school curriculum, when parents are teaching children about what is there in their book, parents are learning themselves. Okay, and also we are targeting children to be change agents. Children should know the importance while they're studying. They should know the importance, and they should communicate the information with their family and the community. Okay, for this purpose, you have to put an importance of vitamin A, about vitamin A deficiency, signs and symptoms. Okay, these things has to be put into the school syllabus, curriculum as well. Okay, these are the other preventions, horticultural prevention interventions we have done. Golden rice or cassava rice or golden tapioca. Okay, if it is a golden rice or cassava type, this is a biotechnological intervention done. Okay, engineering, biotechnological engineering done into the horticulture. So usually in African countries and in some of the Indian regions also, you will find this yellow rice, yellow tapioca, which means it is genetically modified. Okay, biofortified golden rice and tapioca. Cassava means tapioca. So since you have added beta carotene, genetically engineered beta carotene, you get this golden hue. Okay. Then we have village level communities. Village level communities are encouraged to plant more beta carotene rich food in their gardens. Okay, and also the kisans, the whoever is the, you can get the red palm oil online. You can check for it. It is available online. So various krishi vigyan kendras, through them also, importance of vitamin A and the plants which are rich in vitamin A, encouraging them to grow these plants which are rich in vitamin A. Okay, helping the farmers with loans and other support system to maintain and grow the farmlands for vitamin A rich food. Okay, school gardens, school children are encouraged to plant foods which are rich in vitamin A. So through that, these are the prevention strategies which we have through horticulture. Other prevention program is our national prophylaxis program against nutritional blindness. This is through which vitamin A supplementation is given, vitamin A syrup is given to kids who require it urgently, immediately. Okay, as a part of your immunization schedule also, children who come in the age of 6 to 11 months, 1 lakh international unit of vitamin A once has to be given. above 12 years up to the age of 5 years as a part of immunization schedule. 2 lakh international unit of vitamin A has to be given every 6 months to prevent night blindness or any nutritional blindness, because preschool children are at the highest risk of getting nutritional blindness. So prevention of infection, specifically measles, diarrhea, any respiratory infection. Okay, vitamin A deficiency is usually associated with that. So when you're preventing vitamin A deficiency, you're preventing all these infections as well. Fortification. Vanaspati was fortified in India with vitamin A for the first time. All the hydrogenated fats, oils are expected to be fortified with vitamin A and D by law, okay, in India. Common foods like toxicity will not happen because it is fortification. Toxicity will not happen. You don't have to worry about that. Even the midday meal foods, okay, that is also we focus that all the midday meals, all the recipes in midday meals are rich in vitamin A. So dalda, vanaspati, is fortified with vitamin A. You can see here contains vitamins A and D. Milk, by law, all the dairy products, different states have different dairy brands, but everyone are required to fortify their milk with vitamin A and D. Biofortification, I have mentioned earlier, golden rice, yellow cassava is a biofortification. It's a genetically modified rice, yellow in color. This is the yellow rice, how it looks after cooking. It's most commonly produced and given in African countries, the underdeveloped African countries. Main purpose here to provide vitamin A to the third world developing countries where malnutrition and vitamin